Okay, hello everyone, and welcome to another Insights from Women Leaders event. My name is Rola Kaakeh, and I'm the CEO of Salus Vitae Group, and I'll be the host for the event. For those joining us again in the series, welcome back. And for those new to the series, welcome. We're very happy that you're with us today. A little background on the Insights from Women Leaders series is that we launched the series last month to highlight the journeys and contributions of various women leaders in healthcare. These industry leaders will share their insights on a range of topics impacting healthcare, our communities, and their role in shaping the future. We've had 3 guest leaders so far, all providing valuable perspectives. So I really encourage everyone to check out the recordings of the previous leaders if you haven't already done so, and those are available on our website. Now, over the course of an hour, we ask our guest leaders a number of questions. I will start first, and then we'll actually open it up to audience questions. So please submit any questions that you may have in the Q&A box. We encourage you both during and after the event to post any takeaways from the event in the Q&A box and on various social media platforms and tag us at Salus Vitae Group. We love hearing how you've benefited from the various insights and experiences of our distinguished guest leaders. Now, the session will be recorded and available for replay after the event. Now, let's get started. I'm pleased to introduce and welcome today our guest leader, Dr. Charlene Hope. Dr. Charlene Hope is the Chief Pharmacy Quality and Medication Safety Officer at the University of Chicago Medicine. She's a graduate of Midwestern University, Chicago College of Pharmacy. Dr. Hope is formally trained in healthcare quality and patient safety, achieving a master's degree from Northwestern University, and is a certified professional in patient safety. She's an active member of the American Society of Health System Pharmacists and past president of the Illinois Council of Health System Pharmacists. Dr. Hope recently joined the University of Chicago Medicine Center for Healthcare Delivery Science and Innovation Scholars. Now, over the course of her career, she has focused on developing effective implementation strategies of patient safety and quality improvement initiatives. She's led a system-wide initiative focused on the implementation of anticoagulation national patient safety goals within hospitals across the United States. Dr. Hope has worked with interprofessional teams to successfully implement safety strategies to reduce hospital-wide hypoglycemia rates and employed quality improvement methodologies to improve immunization rates. She's a frequent lecturer at the state and national level on medication safety and pharmacy quality topics. Her current professional pursuits include team dynamics contributions to safety culture, human factors, and redesigning healthcare delivery to error-proof complex systems. Welcome, and thank you so much for taking the time to be with us today, Dr. Hope.
Thanks, Rola.
Okay, so let's jump into the questions. The first question we've asked all of our guest leaders is, did you expect to be where you are today?
Quite honestly, I would say that I did not. When I graduated from pharmacy school, it was really to be a lifelong pharmacy clinician, having my own practice, seeing patients, perhaps precepting pharmacy students, doing some lectures at the university, and really that having my own practice and building my own practice. I really had that mindset of that lifelong clinician.
And so I'm sure was it quite exciting to you as you kind of think back in your career to where you were and where you are?
Most definitely. You know, I think about ICHP meeting that I had attended as a pharmacy student. And I think it was during one of the lunch time breaks. And I was actually sitting at a table with a lot of end of career and retired pharmacists. And a lot of them were kind of going back and forth talking about all the different pharmacy practices that they had endured throughout their careers. So, you know, one would say, oh, I was in hospital pharmacy and then I transferred over to home health care and then I, you know, owned my own pharmacy. And that really excited me as a pharmacy student that, you know, I would never be bored in my career, that I could make of it, you know, what I wanted to, and that it would be, I would never get bored in this career because I would be able to transition and pivot to, different types of fields of pharmacy if I wanted to. So while it wasn't what I set out to do, I also probably knew intuitively that I wouldn't end up where I started either.
That's wonderful. So we've broken up the questions in various different categories. The first category where we talk about the future. So we start with the future in mind, and then we kind of come back to the present and move towards that. So when we think about the future, what excites you about the future?
What excites me most about this future is that we're at this point in healthcare where we're changing all our payment models, and that focus on healthcare quality and value-based purchasing has really started to ignite this change within the healthcare. And when I was doing my coursework for my master's program, I still remember one of the lecturers saying, like, their goal of that program was to train leaders that would be leading efforts to redesign healthcare delivery. And that really has stuck with me because I felt it was really continuing that essence of the art and science that I fell in love with that drew me into medicine and eventually into pharmacy. And so, again, we get to recreate ourselves again. How can we serve our patients better? That really it continues to excite me.
That's awesome. And so even when you think about future, it seems like as you're speaking, I kept thinking about creation and designing. And so that is quite exciting if that is something.
Yes, that's the part I love.
That's awesome. And so what should we consider, or what do we need to consider moving forward, maybe as we co-design these initiatives or relook at creating, future needs? So what tools do we need? What do we need to do to embark on our quest to tackle and design these processes?
Yeah, the title of this book by Marshall Goldsmith sticks with me, that what got you here won't get you there. And it goes for as much as we can share in the success of how great the US healthcare system can be in certain aspects in terms of emergency care. A stroke patient can get life-saving medicine within 30 minutes that can help to change their outcomes in terms of their quality of life. Does not happen in a lot of places throughout the world. And we can't rest on our laurels, right? What got us here is not going to help us into the future. So as globally as the healthcare industry, but also as ourselves working within that industry, that we ourselves are success, we can't rest on our laurels. All the skills that got us to this point is not going to get us into the future. And I have a kind of cute story about that. When I started in one of my roles, I was a regional clinical director, and we worked with a lot of Excel spreadsheets. And at that time, being able to engage one of the features called a pivot table, which actually helped to analyze the data for you, was a skill that not everyone had. That kind of gave you that expert, designation of using Excel. Well, now that I've mastered the pivot tables, we have to start thinking about data in a whole different way, and the way that big data in terms of analysis and visualization of that data. And so here at UCM, and I'm sure at a lot of organizations, they're using a program called Tableau, which is like the next level of, using your data. So, during the COVID lockdowns, you're kind of like, oh, what should I do with my time? I'm like, you know what? I need to learn about Tableau. So I spent my time learning about that system, how the data actually can flow from Excel into this system to help you do your work more efficiently. And those are the types of things that we have to always have on our radar and to make time for, that I know that those Excel skills are only going to get me to this point and has helped me be successful in my role, but it's certainly not going to help me into the next 10, 15 years. So always looking for those opportunities to up your skill set so that you can provide the best value to your department, your organization.
I love it. I think the take home a lot with that is the growth mindset in terms of your skills and the tools that you have available to you. So you understand first step, there is one, not necessarily the first step, one step, right, was the Excel pivot table as an example. And then there's more advanced that you continue, software that you continue to build upon to take advantage of what exists, right? We just have to retrain or train ourselves in new areas. So
yeah.
I really like
And,
that.
you know, I was just thinking as you were speaking that that time that I took to learn the system, although I'm not going to be like a deep user of Tableau, it actually then allowed me to work with our data scientist on a project that we were working on. I could now use the same lingo when she was speaking to me about certain things or asking me questions. I knew why she was asking me those certain questions in terms of building out. So that helped to build a relationship or help to forge that relationship a little bit faster because we were able to speak the same language a little bit faster if I hadn't done that at all. So another great benefit of, again, that growth mindset, trying to learn things not only within your particular role, but learning about other people's role and other things going on in other people's industries.
Yeah, I could not agree more. And I think that there's a very valuable point in what you mentioned in terms of, even though you might work across disciplines for a specific project or initiative, and you're not going to be that expert maybe in the data science world or maybe in informatics or whatever it is, but the fact that if you take the steps to learn the basic lingo, like you said, understand why is it that they want to ask certain things so that you can provide that. And sometimes even when you do your background research on that, you'll realize you're providing that information before they even ask, right? And
Yes.
so I think that is such a valuable skill to have, is not that you're not gonna be an expert in that topic if you're just at least willing to learn about it. So you can do your job and help the other person as well.
Absolutely.
I love it. And you also touch on a point that's been made by several guest leaders in terms of building a trusting relationship. So with whomever you're working with. So love it. Okay, so the next question is, how have your past and present experiences truly shaped your future outlook? Knowing that future outlook is your current future outlook, and that can change as well. But how has that kind of changed and adapted throughout the years?
You know, I've been thinking about, you know, what the future will look like for my career. I'm mid-career, so I still have another 20, 25 years of working life. And, you know, it's kind of what I touched on, right? That I can stay in the moment, enjoy my job that I have now, bringing the value as much as I can, but then also being open to the opportunities that come my way, and kind of trusting, you know, the way that my career will develop based on my interests and my strengths and kind of what the needs are in the future. So, you know, right now I'm very much engaged in, again, healthcare quality and, you know, that redesigning of healthcare. And so, you know, when I graduated from pharmacy school, at that time, we still had the 4-year degree and the 5-year degree. And so I remember reflecting at that time, oh, you know, a lot of these pharmacy schools are going to go all PharmD. What's going to set me apart from all the other PharmD candidates that might be looking for jobs? Oh, I better do a residency. Just for the audience of those that are in pharmacy, at that time, out of a class of 100, only 3 of us did residency training, which is very much the opposite now. Most pharmacy students that are graduating are pursuing some sort of residency training. You know, with that residency training, as that started getting more people were completing that. Okay, what's going to set me apart from all the residency trained? Okay, let me get board certified. So it was always this, what can I do to bring a unique contribution to whatever role that I bring to it? And that's what I think of moving forward. What are the skill sets? What do I need personally that's going to set me apart from other people in my field, so that I can provide a unique contribution? And so although I might know exactly where I'm going to be in the future, it'll always be with that mission in mind, that I always want to be bringing the best value to my organization. And so, when I think about healthcare, there's opportunities abound, whether I stay within the pharmacy profession, where I start maybe venturing out outside of pharmacy, that it'll always be with that in mind.
I love how you integrated both your commitment to excel and add value in your current position while also continuously looking where you can add additional value. So you're really merging the past and the present in terms of your growth that you want to ensure that, and that is wonderful. So the last question for the future questions is really, what's in your future? What do you want your legacy to be?
So when I think of that word legacy, it can be a little intimidating, because when I think of legacy, I think of, Martin Luther King or, Ruth Bader Ginsburg, right? These people left legacies. Like, I'm not them, what's my legacy? And quite honestly, it has been over the years, the small acts of kindness that I have shared with others, whether it's our PH pharmacist who I encourage to say, hey, go for that, add-on PharmD degree. It's going to take you this far, or writing letters of recommendations for students to get into residencies. It could be, again, mentoring students to do posters, helping someone that was thinking of, studying for the board certification exam and not quite knowing where to start. That all these small contributions to other people's lives that makes them better. So nothing brings me greater joy to get an email or a phone call. Charlene, thank you so much for writing that letter. This is what I'm doing now, and I wouldn't have been here if you hadn't done that one small thing. And so that will continue to be my legacy, and what drives me is to continue to help do that one thing that might make someone else's life better than if I hadn't done anything at all. And that would be enough for me.
And so I actually also want to say, when we started advertising for this session and talking about that you were going to be our guest leader, from people I know and I don't know, literally the first thing that they would say is that she encouraged me, she inspired me to be a leader, and therefore we see so much leadership and inspiration coming from her being you, of course. And so, and I think that speaks a lot to what you are talking about now, in terms of these small acts of kindness can be, even small, what might seem small, when you talk about it in general, can have a truly enormous impact on those that are receiving it. Because many of our guest leaders too have talked about simple stories of simple acts of kindness that shifted their career, shifted their perspective, and then as they grow, they pass that on, right? They truly have a ripple effect. So that does truly build a legacy. You do not have to have the huge name, but the name, and we talk about this a lot in leadership, even with the guest leaders, the name only means as much as the impact that you make to people.
Exactly. And I think we underestimate when we share those small words of encouragement. I think back again in pharmacy school, we had two kind of admin secretaries in the Department of Pharmacy Practice that, would help us, coordinate speaking with our professors and things like that, or if we needed to submit some paperwork. And I remember this one afternoon really clearly, and I was just in there talking to one of the admins, and she said, you know what, Charlene, I see you going on to doing some really great things. And I'm like, how does this lady know this about me? Like, why is she saying? But that helps to motivate you. And it, like, to this day, it took no effort. It didn't cost her anything. But giving someone some words of affirmation can really, again, change their perspective, I can be successful. And I think even subconsciously, it's back there. Someone saw something in me, and I don't know what they saw in me, but, I can become that. So I think that's a lesson for anyone that you're interacting with, to take that time to say a few kind words.
100% agree. Okay, so now let's come back to our current present and our realities at the moment. What current initiatives are you working on that you are most excited about?
Wow. I'm really excited on some work that we're doing with medication reconciliation, patient counseling, looking at even the paperwork that we give patients upon discharge from the hospital. Again, communication is something that in healthcare, it's one of the #1 reasons for sentinel events, but it is also when it comes to communicating with our patients about medications that we continue to be challenged with how to do it very well. And so we actually have a interprofessional efforts, really starting to focus on how well are we communicating to patients about their medications. I think about one of our pharmacists, Kaakeh, she just did a whole revamp of our medication history process that we have our pharmacy students lead. I got inspired by one of our outgoing clinical coordinators to look at our discharge medications. There's a lot of little errors on there. And if a patient has poor health literacy, how are they going to be able to interpret some of this information? Or, some information being driven from the computer and some of it being kind of notes that someone's typing in. And so we're currently doing an audit of that communication document and seeing, hey, what can we do to improve that? We have our hospitalist team saying, hey, what can we do better as hospitalists to make sure that we're doing an accurate medication reconciliation? And so to see all these three things kind of come together is really exciting to me. And especially at a time where we're looking at what we can do to provide more equitable care to our patients. This really is exciting me as to where this project is going to go. The second component, which is really around, safety and quality improvement, is the topic of, sustainability. We are constantly going through change, and we are usually really successful as sometimes of getting a coalition together. We make that improvement, we see the change, and then we have to pivot. And then what happens a couple of years later, no one's looking at it anymore, and then we're back to ground zero again. And sometimes it's a whole new team, new managers, and there's no historic information as to what was done in the past, and now we're recreating the wheel again. So really looking at sustainability of quality improvement changes. How do we do that? How do we maintain changes that we make so that we don't have to keep on kind of going through this cyclical change? On the safety end, I know we've done a lot over the last 20 years in the patient safety arena. We have a lot of technology that helps us catch errors, but technology is not the end all be all. Within implementing technology, there are inherent risks. So really looking at what is the effectiveness of safety intervention? If we put in a alert into a system, is that alert really effective? Is it really helping to prevent errors, and kind of focusing on the effectiveness of errors? And then the last one that I've been really interested in and still doing a lot of research on it is psychological safety, and the intersection between needing psychological safety to promote a high-performing safety culture, and psychological safety as it pertains to inclusion within a department, and how those two things intersect. And if you address one, does it impact the other? And so I'm looking forward to, again, doing some more research on that topic and seeing how we can study it.
I love it. I think those topics too, what's particularly interesting is in terms of even getting actually to your previous point, when you make small changes, they can have very positive impact, and they can also have negative impact in terms of safety and quality. And like you were talking about, integrating the concepts of utilizing technology and the human, the psychology aspect of it, as well as various elements. So that is very, very exciting. And I also do want to make a shout out to your team, University of Chicago Medicine. They're truly, you guys have a great team there as well for that. But so these are very exciting initiatives. You guys have so many things going on kind of across the board. But what obstacles and challenges keep you up at night?
Really, it's communication, team communication. You know, I used to work for smaller organizations, 300-bed hospitals, 150-bed hospitals. And so being able to communicate a change within the organization sometimes was a little bit easier. But then when you start going to large organizations like this one, how do we communicate change within the organization effectively so that all stakeholders are aware of that change is still one that kind of keeps me up at night. When I look at some of our more serious events or events that reach patients, at their heart is team communication. And so that primarily keeps me up at night. Like, how can we do this better? We have all these ways of communicating, whether it's email, text messaging. I think now we're going to have like a system where you can just kind of just tap a button and talk to someone. Will those things really help make us safer? I think that's still yet to be seen. We're trying hard at it, but that one still keeps me up at night.
Yeah, and that's definitely something that's constantly changing, right? Even how you individually communicate and then across large numbers of people.
Yeah.
So,
I think about the drug shortages, and I know this has been a topic that your team has been working on. It just changes sometimes by the hour, where you might have a meeting, we don't have this in stock, we make all these changes, we start the communication, and then maybe by the afternoon, hey, you guys, we got the drug in. How do you now reverse all that communication that you just sent out, knowing that someone might only read their email once a day, once a week, once a month? They might see one communication and then not see the other one. And so again, those are things that still remain a challenge, I think, for a lot of organizations.
Yeah, there's significant safety implications if the wrong communication is communicated during a drug shortage. Not even necessarily the wrong, like you said, delayed or old information, or
right.
if you're changing by the hour or so, and then everything, and you're getting like 20 emails, how do you prioritize? How do you know with that?
Exactly.
So we are still in a pandemic, and as a result of any sort of disruptions, any sort of crises, there are also opportunities with regards to new initiatives that might have emerged, or new approaches that we've taken as a result. Are there any new initiatives that have emerged on your end as a result of the pandemic, and do you see that continuing after we quote unquote get back to normal?
Nothing specific, I would say, within my role within the pharmacy. But what I've been excited about has been just the move to telehealth and the opportunities within the telehealth space. I know I've started to see us, again, leveraging our technology to help to kind of foster a better patient experience. So I had my first telehealth doctor's visit when I was at work, and I could talk to my doctor and have my doctor's appointment at work, which was amazing. I did not have to leave work. I didn't have to find parking, pay for parking. And so for those patients that also have some of those barriers, all of us that are patients, right, that have those barriers that might keep us away from the healthcare setting, seeing your doctor, accessing care, I'm really excited about, the work that's being done in the telehealth space, and still a lot of opportunities for pharmacy, as well too. I know that we had a lot of telehealth type visits. Again, the project I was talking about with the med histories, that's going to be virtual. These are going to be students on computers counseling patients in the hospital. And so again, the impact on, the workforce and how we do our work is really exciting. The other really great example I had was getting ready for an eye appointment. And I got to fill out all the paperwork at home. So all your insurance information, your driver's license, all that annoying paperwork that you hate doing when you go to the doctor's office, I got to do at home. So that when I got to the eye doctor, I literally just walked in. It was amazing. So, starting to see these types of innovations start to spread as a result of us being in this COVID situation, I know definitely are not going away, because I know too many of us are really already enjoying some of these changes that have already been made. I was just thinking a little bit in terms of, COVID within pharmacy. One of the things that we haven't really resolved, but at least it's going to start studying a little bit more, is around the practice of barcode administration. When we have our patients in isolation, how can we still ensure that those safety practices are staying intact, or how do we adjust them so we still ensure that we can still use those safety practices and they're not being susceptible to workarounds, which could lead to errors. So that was probably like the only kind of main thing that happened in our space. I think, at least affecting my role personally.
Yeah, there's definitely so much opportunity. The acceleration of technology and being able to best utilize it in ways that address kind of challenges that we had before, but even our current challenge during the pandemic, just to your last point about barcoding, and maybe that will push towards more utilization of barcoding as a result, across systems. When you're in large academic medical centers, naturally you are more advanced in terms of than smaller settings, but we're still seeing so much innovation as a result of that, for sure. So the next set of questions focuses on leadership. We ask all of our guest leaders a simple question on leadership first. It's, how would you describe a leader? You responded with the following: a leader is one who creates an environment that enables people to contribute to the best of their abilities to the mission of the organization. Can you elaborate on this and what really shaped this outlook for you?
Yes. Again, earlier on, probably my first leadership position as a clinical manager at a teaching hospital. And I had the fortune of working for a female pharmacy director who had taken me under her wing and had started to, we used to have some meetings where she would start mentoring me on some of the pharmacy operations and leadership aspects. And being a new manager and being the type A personality, I had high expectations for everyone. I wanted everyone, at the top of their game. And, she sat with me, she's like, Charlene, when you have a team, you can't have a team of all A players. She's like, you're going to have some of your A players, you're going to have some of your workhorses, you're going to have some of those people that, are very loyal. And it's really having a combination of all these individuals that really makes the team. And, I'm sharing it with you because it still sits with me. And I think now 20 years later, or it's just less than that, but, 15 years later, I can see that now. Being a director for a medium-sized hospital, I saw what happens when you have too many A players and you're not really appreciating everyone that's on the team. I see it now in where we are in healthcare, that we really do need to have diverse teams, that we really do need to appreciate what everyone's bringing into the table, and that we have to create an environment where people feel comfortable being their full selves at work, so that they feel comfortable on speaking up and sharing some of those experiences. And whether it's whether it's a mom and, hey, I tried this, technique with my teenage daughter, maybe we should try that, or all of that matters. But we sometimes will discount certain experiences when that can help spark an idea. If that person brings that up and feels comfortable, that might spark another idea and then get us to a new creative solution that we would not have thought of at all before. I just recently had an opportunity to speak with a pharmacy technician, and we were just sharing our background. And I asked her, well, how did you think about pharmacy? Oh, well, I was training to be an air traffic controller, and I really like the engineering aspect of it. And, life circumstances kind of led her to look at pharmacy. Well, here's someone who likes engineering, who has this, background, having some knowledge of air traffic control. How could that help a pharmacy department or healthcare, someone that's thinking that way? But if I have the leader just say, oh, that's just my technician, I've just lost all of that knowledge that I can use to help me with problem solving. If I invited that person to share, like, hey, what do you look at this? What do you think? Right? I think I just had a conversation with one of my pharmacy technicians, and I said, we were talking about, again, balancing strong performers versus low performers. And I was saying, oh, well, if you just balance high performers on each team, she's like, no, that's not the concern. We'd want to balance low performers on each team because they're the ones that kind of pull most of the energy. And I was like, I never thought about it that way. And so again, it just keeps on reaffirming to me the importance of everyone being at the table and being able to voice their different perspectives so we can all think a little bit differently.
That's so great. And it gets at the point of each individual being very multidimensional and then taking advantage of, in terms of the thought process, perspectives, because even as you were saying that in terms of air traffic, I was thinking, oh, but that's great for medication safety. Like, there's so many ways you can incorporate that. But what I actually really also enjoyed about the quote, and as you're talking about it as well, is when you're looking at your team as a team and then as each individual person, that you're able to, when you enable them and bring out those multi-dimensions, it will benefit your team, your organization, and the communities that you serve.
And again, to value everybody's role on the team. Everyone has value, everyone, right? And it's back to those words of affirmation, even if it's that person that, they're not your strongest player, but they show up every day on time, they try to do their best. Thank you for showing up on time today. Thank you for continuing to be like the strong foundation of our department. Without you, we would not be able to function the way that we would. Again, sharing those words of affirmation is just really important.
Make a huge difference. So the next question focuses on what leadership lessons and advice can you provide current and future healthcare leaders, both men and women, at different stages of their careers?
I say at the beginning of your career, it's really I think two things. The first one is to adopt a practice of self-assessment and self-review. There's going to be days that you hit it out of the park and it's going to be a great day. Take advantage of those good feelings and take time as, what did I do to make this, a successful, venture or achievement? What made this day a good day? And vice versa. And it's going to happen to all of us. You're going to have a bad day, or you're going to say something maybe that you shouldn't have said in the heat of the moment. To self-reflect and go, oh, why did I react in that way? Like, what caused me maybe act in a way that isn't a way that I'm used to acting, or what made this a bad day? And taking that time to self-reflect and start to gather that information, it's just a wealth of information and helps with your own self-development as a leader. And I think the sooner you're able to adopt that practice, that you could actually make exponential leaps and bounds, toward, in your developing yourself as a leader and through different leadership roles. The second one is network. Meet people that can help you in different ways, whether it's to continue to build a strength or to help you in an area where you're probably a little bit weaker, and to kind of learn how to bring together a coalition or a team of people that can kind of help advise you throughout your career, because we're always going to have different types of situations and barriers and things that we go through. So kind of knowing who to call when you're dealing with certain issues is always a good one to have. I was sharing with Rola prior to the call that hopefully I'm not going to miss this point. Just the power of networking within a professional organization that many times I think I was invited to interview because people knew that I was a part of a professional organization. And so my ability to open doors and have those opportunities is an important one. And so having that network can open opportunities that you didn't really think that might be available to you. So just a really important one. Mid-career, I go back to that quote, what got you here is not going to get you there. And if you feel sometimes as a mid-career that you're feeling stuck, you don't know what direction you should be going in, is again, looking at what's going on with my industry, what excites me, what are my strengths? And then once you're kind of doing that assessment, to then start exploring and seeing, where can I bring value in the future? Where have I brought value in the path? And then you just have to jump, right? And try that new thing. I've been seeing a lot on, the LinkedIn feeds. I've been really excited and seeing a lot of different paths pharmacists have been going into, whether it's podcasting, mentoring, doing kind of mastermind groups of doing entrepreneurial types of pursuits and different non-traditional practices. And these are the things that we have to do that, again, as pharmacists, we tend to be the introverts. We're very conservative. We don't like taking risks, but this is the time where we might have to upskill and then have the courage to jump and try something new.
These are all so wonderful. So the last question before we start opening it up to the Q&A is that we tend to end these list of questions with an opportunity to support one another and recognize the positive influence we have on one another. So can you name a woman who has inspired you, and why did you choose this woman?
Well, this person is not a celebrity, not someone that's well known. The person that inspires me is my mother, Charlene Hope, who spent a long career as a nurse and really is the reason why I became a pharmacist. I was really dead set on becoming a medical physician. And, I think like most moms, when you're dealing with a teenager, well, have you ever thought about pharmacy? You might not want to put, your eggs all in one basket. I'm like, oh, I don't know what she's talking about, until I think I ended up doing like a career test where I actually scored quite high for pharmacy as being a career. But my mom inspires me in that she always said to me, be yourself. When I was feeling nervous about being in a new space or meeting new people, Charlene, don't worry about it, just be yourself. That's all you need to worry about. And I would share that advice with everyone, to just be yourself. The second one was to have courage and to speak up when others don't have the courage to speak up. You be the voice for them. And so just having that courage and that resolve to speak up when others, which is so important in safety, right? Is really modeling for others what it takes to be able to admit a mistake or to admit that you're wrong. Maybe, again, we all are stuck with our different biases and different perspectives. So when you hear someone else's perspective and you're like, oh, you know what, I guess I can see it that way. To be able to voice that, I think is really important. And then the last one is just shoot for the stars. You just always shoot for the stars. And this has been consistent throughout my career, that she's continued to inspire me in this way. So I share her advice with all of you.
That is so great, because it gets at several points that you also made throughout our conversation in terms of kindness, humility, believing in yourself, sometimes going outside of your comfort zone, but also authenticity, right? And so to being true to yourself, using your voice. I mean, ultimately it is your voice to speak up. And when you're in rooms that, Sandra also mentioned this too, when you're in rooms that there are other people that maybe don't look like you or with your same background or experiences, use your voice for good to help the community. And I think so much of what you've touched on and so much of the influence that your mother has had on you, I think is also built not only your ability to believe in yourself and move throughout your career, but to also do that for others, because it seems that that's something that is very important to you. And I've actually seen and heard this from others in terms of the way that you make them feel with even small acts of kindness. So this is really great. So now I just want to open it up. We've gotten some questions. You can put your questions in the Q&A box, or you're welcome to also send them on the chat. So one question that we have is, what would you say are the most important medication safety issues you're dealing with now?
I would definitely say that, issues around drug shortages and, again, what I touched on about with the communication. And the other challenge with the drug shortages or any new drug that you're bringing into the organization, now that we have so much technology involved, that it's not as easy as just bringing something into the organization and that we have it available for use in a few hours. I think of, a drug that we bring in, we have to have it programmed into the electronic medical record. Then we have to have it in our Omnicell or automated dispensing. That's a different technology. If it's in the IV room, that's another piece of technology. And each one of these have their own database. All those databases are connected to one another. And so there's a number of checks and balances all throughout all of those. And before you can even have the med prepared and ready to send to the patient. And so, again, with that system being as complex as it is, there's risk inherent in that, in making changes, adding new drugs, making sure all those checks and balances are in place. And then this becomes more of a challenge in areas where you might not have all technology employed. And so you're kind of doing a mix of both, and you have a manual processes as well as technology. So I think a lot about our perioperative areas, which has been a concern for me lately as well too, because of that combination of manual processes and technologies, as well as the culture of safety that are in a lot of our high demand, high stress areas that can sometimes undermine some safety practices that are some of the top things of concern. So, and again, I think a lot of it is surrounding technology right now, quite honestly. Alerts, again, if we have an error, hey, let's add an alert. I think one of our residents did a study that I think our pharmacists can see something like 30,000, types of alerts at them. How does that, and I've also had errors where the alerts fired, people overrode them, and an error almost reached a patient, right? So these are the things that we have to be really mindful of in terms of leveraging technology and making sure that it really is helping us and not, being susceptible to some of those weaknesses or failures.
That's great. There's another question around now shifting a little bit more towards advice. So what advice would you give for a seasoned pharmacist looking to pivot or make a major transition between types of practice, especially in light of current trends?
Can you repeat that beginning part? I didn't quite hear it.
Of course. So what advice would you give for a seasoned pharmacist looking to pivot or make a major transition between types of practice, especially in light of current trends?
Yeah. I think to me, this is the time where if you have an existing network, to start reaching out through your network, maybe calling previous colleagues, see what's going on in their organizations or what's going on, in their current roles. I think also it might be time to start building new connections and seeing what's out there, and putting yourself in spaces that maybe you hadn't been in the past, so that you can start exposing yourself to individuals that can kind of help you down that path in terms of recommending different courses or professional organizations that you could be involved in. This is really the time where you have to try to you have to foster building relationships to help to open up those opportunities to you. It's not easy. It's more than me just kind of sharing it on here. I think it does take some courage and, time commitment to make these types of changes. But it's one where, I spoke to earlier on, is looking at those things that you like to do, that you're strong at, and then really doubling down on that. I'm definitely of that camp of do the things that you're good at and find a way to do it creatively or to add value that you didn't think you could add value previously. So looking for those new opportunities. But this is when, I love the work that, Rola is doing in terms of exposing everyone to these women leaders and knowing that, hey, we're all out here, connect with us, seek that different advice and starting to build this network so we can all, help each other along in whatever little way that we can.
Yeah, to truly support one another, 100%. I want to get also the next question back at some of the points we also you mentioned before in terms of some of the biggest challenges, and that's around communication. And this question focuses more on interprofessional education, communicating with those outside of your teams, your discipline, kind of across the health care sector, even beyond. What strategies do you use, or what should we keep in mind as we communicate with those that don't have the same background as us, or necessarily see it the same way?
Yeah. I would say this is an area that I kind of enjoy the most about my role, and some of the fun that I have on my end, working in different organizations and committees. There's a couple things. I can give a bit of an example of what I do or how I do this. I think about being in a meeting, and maybe I know that I might need to work with a physician or nurse on a project. I might make a point of sitting beside that individual at the meeting. And then just what naturally happens sometimes before a meeting, and of course this is pre-COVID, right?
You're sitting 6 feet apart right now.
Right, so 6 feet apart, that's right. That's where you can just have a casual conversation. How's it going today? How's the work? Oh, I'm new. How long have you worked here? Where you're kind of just having that casual conversation and getting to know that person. And that's the beginning of building that relationship. What's even more powerful if you can get them to start talking about their family or what they did on the weekend or something like that. So you can start listening for those things that you can start associating with that individual, or maybe you tap into something and you see that person just change. You're like, oh, I got it. You like, jazz music. Well, every time I see you, I'm going to bring up something about jazz music because I know it's going to brighten your day, or I'm going to build that connection, or I can use it as a story if I need to convince that individual to try to do something. So these are the beginnings of influencing skills. And again, whether it's a physician, a nurse, a data scientist, these are all the skills that you want to make the time for. Also, usually in meeting settings, I not only pay attention to people's verbal communication, I look at their nonverbal communication. I look at how they're reacting when someone's saying something. oh, or are they throwing like eyes at someone else? Then I know, hey, these two people know each other because someone's raising an eyebrow or they're throwing a side glance at someone else. I make note of all those little things. And I try to build a story or build something around that I can leverage at another time. I think one of the things that I learned later on in my career was this thing about office politics. A lot of times as clinicians, we're like, oh, I'm above office politics. I don't get involved with it. I have nothing to do that. And I learned that actually was at my detriment. No matter what, we're all involved with, office politics. Whether you like it or not, you're involved with it. It is important for us to know how individuals are networked within our organizations, so that, number one, you need to be on sometimes B's and Q's when you're saying certain things to certain individuals, because it might get back to someone that you may not think it might get back to. But you can also use that to your benefit in terms of if you're trying to get an initiative for that, you might not need to go to that person directly. You can go to someone that has influence with that individual to help to plant the seed or to help get an initiative, over the barrier. So this is the way that I see, communication being really important, where soft skills are becoming more and more important as technology takes over a lot of the technical things that we do. It's starting to now rise to the top, the importance of influencing, collaboration, team communication. These are the skills that are really going to help leaders be successful into the future.
So as you're thinking through, I actually also, when I was thinking about communication and how so many people focus on the actual information that they're communicating first, whereas how you're describing it is you are first really talking about the environment. You are creating first the environment. You are trying to understand the environment. You are then looking at the person or entity or whatever it is, trying to understand the dynamics, and then you're thinking about the information, yes, which is very critical steps that people often, I think, forget because we're so focused. What's the exact information? Let me write a perfect email with all the great information and not really understand those other dynamics. So that is
especially with change management. A lot of people think like, and I think it's one that, especially if you're in quality and safety, I know that if I go into the room and I say, hey, Joint Commission says we have to do this, blah, 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 it doesn't mean that it's going to happen. You have to really find ways to influence people that this is the right thing to do. You have to address people's barriers. If you don't address those barriers and help to remove them, your initiative will go nowhere. And so I've also learned that sometimes it takes time for things to come together, and to be okay with that. And I think that's also really good, especially for young leaders. A lot of times we're just really anxious, like, we want to get all these things under our belt. We need to get there. There are some things, the things that end up being the most impactful for you in your career are ones that you're like, you know what, let me give this time. Let me allow this to kind of marinate a little bit. And sometimes the moons align and everything kind of just falls together. And that thing that you were spending, 6 months, it gets kind of resolved like in a short period of time because you've allowed that time to kind of pass. So it's really important.
Wonderful. So we only have about a minute or so left. So any other closing remarks or final thoughts like you'd like to add?
I guess I'll share, one closing remark specific to women in leadership. Rola reminded me of this story that, a lot of it is our own mind game with ourselves. Early on in my career, I had an opportunity where I could have stepped into a leadership role very quickly. And it was one where someone else saw leadership skills in me where I was like, no, I'm not ready. I need to have all these. I haven't checked off every box checklist in order for me to feel comfortable doing this role. And in retrospect, if that person felt I had the right skills to do that job, that maybe I should have had more faith in myself and jumped in and trusted that I would have figured it out. And so I think I leave that as a closing, part, especially for, our women leaders, that we don't allow perfection to prevent you from taking advantage of a role. You will figure it out. You know, if you've gotten anywhere in your career, it was due to the fact that you were able to figure something out. And so with all the opportunities that are out there, you know, be yourself, take courage, and shoot for the stars.
I love it. Yeah, it's so wonderful. There's so many different themes in our conversation today in terms of simple acts of kindness, authenticity, courage, really going outside of your comfort zone and thinking about how you build yourself in terms of your own skills, but as well as your network, and definitely the power of network as we've talked through this. So on behalf of Salus Vitae Group and myself, I would like to thank Dr. Charlene Hope for joining us today and for sharing her experiences and outlooks on various topics. There were so many items to think about and truly use as frameworks moving forward for anyone at any stage of their career. So we have several exceptional guest leaders in the coming weeks, so please visit our website, salusvitaegroup.com, to register for all of the upcoming events. So many great people doing wonderful things. And again, we truly need to support one another and hopefully learn and grow together. And so with that, thank you all for attending. We hope to see you at the next event. Thank you.
Thank you.